Very welcome to the Scoliosis Awareness Month series, and we have Dr. Firoz Miyanji from Vancouver, British Columbia, one of the well-renowned surgeons in Canada and the world. And let's get started. Dr. Miyanji, we get this question from young patients and the parents. What is VBT, or the vertebral body tethering, and what are the ideal candidates for this surgery?
Great, Raj. Thanks for having me. So VBT, or vertebral body tethering, is really a technique that is used to treat idiopathic scoliosis, which is motion preserving, and it is a fusionless procedure that we are now introducing in the treatment of idiopathic scoliosis. Ideal candidates, really two things that would make a patient ideal is their skeletal immaturity, so they need enough growth that we can harness that growth so we get a balanced correction of their spine. And then their curve size. So we're looking at surgical curves, but of a modest severity. So you don't want too large of a curve. And of course, you don't want too small of a curve, because then you can have some complications that we've learned about in terms of revision procedure. So I would say skeletal immaturity with moderate size surgical curves would be the ideal candidates.
Great. And what are the risks and complications associated with the vertebral body tethering, Dr. Miyanji?
So the risk, I mean, it is a surgical procedure, so there are inherent risks, but some that are more unique to VBT, which we've learned about over time, is sometimes VBT is a little too, it works too well, so you can get overcorrection where the curve starts to swing the other way. Sometimes VBT is just not effective enough, and so you get not much correction of the curve, and the tether can break or fail. And in doing that, sometimes the patients can progress their curvature and may need another reoperation. And then finally, just like other surgical procedures around scoliosis, like a fusion, sometimes above and below the level that we've tethered or instrumented, we can get other curves develop. And this is more so known as the phenomenon of adding on. So those are pretty much more of the unique risks around VBT.
Thank you. Thank you very much, Dr. Miyanji. Thank you for your time.